talk about BP generally. BP simply means it's a short term for what? Blood pressure. Everybody has blood pressure. It is when this blood pressure is now high that we now have high BP. It is called hypertension. If it is lower than normal, it now becomes low blood pressure, or you call it hypotension, or it is normal. Now, in that first trimester, there is always a reduction in blood pressure. That same estrogen that is high in pregnancy has a way of reducing blood pressure. Normally, blood pressure is divided into three categories. We have normal blood pressure, which is the one that is lower than 120/80. Then between 120 to 139, they are called pre-hypertensive. This person may develop hypertension, and you tell that person to start DASH. And DASH simply means dietary intervention towards stopping BP. You will come to dietary modification. Take more of fruit, take more of vegetable, increase exercise, reduce stress, try to sleep more. And by the time we have done all these things and the BP refuses to come down, that is when you talk about starting drugs. So much so in diabetes. It's not the moment you just say that somebody's blood sugar is 130 fasting or 140, you say metformin, glucophage. At that time, we should be able to do some dietary modification. What is the problem? Are you sure this thing is not caused by the drug this fellow is taking? We have to look around the whole drug. On an energy drink, is there any other thing this person is taking that could predispose this person to diabetes? If the answer is no, then let us go to exercise. Stop alcohol. If this fellow is smoking, stop smoking. If your blood pressure is close to high range, as at the time you are in your first trimester, it simply means that it was higher than normal in your pre-conception period. But what happened in most times is that most women will not go to the hospital. Most of them will not check their blood pressure. So the only time they will appear in the hospital is when they are pregnant. The BP might just have been there because it's a silent killer. Because it's there, it's not giving you any sign. So you will not check. And most women, by the time they finish delivery, you tell them to come back in 6 weeks' time. They will not come back here again. They just assume that the absence of symptom means cure.